New research from the Monash University in Melbourne has uncovered a concerning link between cholesterol fluctuations and dementia risk. Unlike previous assumptions that primarily associated high cholesterol levels with cognitive decline, this study suggests that instability in cholesterol levels over time could be a far more significant threat. Given the alarming rise in dementia cases worldwide, this discovery raises serious concerns about how we monitor and manage cholesterol, potentially reshaping current medical guidelines. Every year, nearly 500,000 people in Germany alone are diagnosed with dementia, a progressive neurodegenerative condition that strips individuals of their memory, cognitive abilities, and independence. While aging and genetic predisposition are well-known risk factors, many lifestyle-related contributors, such as obesity, lack of physical activity, and poor cardiovascular health, also play a crucial role. This latest study adds another layer to our understanding, suggesting that even those with cholesterol levels considered within a normal range may still be at risk if their values fluctuate significantly over time. The study, which examined nearly 10,000 participants from Australia and the United States over an 11-year period, found that individuals with the most unstable cholesterol levels had a notably higher chance of developing dementia. Even after adjusting for other factors such as age, sex, and pre-existing cardiovascular conditions, the correlation remained strong. This suggests that it is not just high cholesterol that poses a danger to brain health, but rather the body's inability to maintain stable lipid levels over time. Cholesterol plays a crucial role in brain function. It is essential for cell membrane integrity, synaptic function, and the production of neurotransmitters. However, when cholesterol levels fluctuate dramatically, it can contribute to chronic inflammation, oxidative stress, and damage to blood vessels in the brain. This instability may accelerate the accumulation of harmful plaques and tangles, which are hallmarks of Alzheimer's disease and other forms of dementia. These findings present a troubling challenge for both patients and medical professionals. Routine cholesterol tests typically provide a snapshot of a person's lipid profile at a single moment in time, but they do not capture long-term fluctuations. As a result, many individuals who appear to have normal cholesterol levels may unknowingly be at risk. Without a clear understanding of how cholesterol stability impacts brain health, current guidelines may be insufficient for identifying those who are vulnerable to cognitive decline. The implications of this study extend beyond dementia prevention. Cholesterol fluctuations have also been linked to an increased risk of cardiovascular diseases, including strokes and heart attacks. This means that individuals experiencing cholesterol instability may face a dual threat: damage to both their heart and their brain. Given that cardiovascular health is closely tied to cognitive function, addressing cholesterol fluctuations could be a critical step in reducing the overall burden of dementia and related disorders. Despite these concerning findings, there are no established medical protocols specifically designed to monitor and manage cholesterol fluctuations. Most treatment approaches focus on reducing overall cholesterol levels, often through statins or dietary changes. However, these interventions do not necessarily address the underlying issue of instability. If future research confirms these results, doctors may need to shift toward long-term cholesterol monitoring and personalized treatment plans that aim to stabilize lipid levels rather than simply lowering them. The broader question of why cholesterol instability occurs remains unresolved. Some scientists speculate that frequent fluctuations may be driven by a combination of genetic factors, metabolic imbalances, and lifestyle influences, such as erratic dietary habits, stress, and inconsistent medication adherence. Others suggest that conditions such as insulin resistance and chronic inflammation may contribute to lipid instability, further exacerbating the risk of dementia. Given the lack of awareness surrounding this issue, many people may be unknowingly putting their brain health at risk. Unlike well-publicized risk factors such as smoking or high blood pressure, cholesterol variability is rarely discussed, leaving many patients in the dark about a potential threat that could be lurking within their own medical history. Without intervention, millions of individuals could face an increased likelihood of cognitive decline in later years, with few warning signs until irreversible damage has already occurred. In light of these findings, urgent action is needed to further investigate and address cholesterol instability. Researchers must determine the precise mechanisms by which fluctuations contribute to neurodegeneration and explore potential interventions to counteract these effects. At the same time, Medical professionals should consider incorporating cholesterol variability into their risk assessments for dementia, ensuring that at-risk individuals receive early warnings and targeted prevention strategies. While the study's findings are concerning, they also provide a valuable opportunity for early intervention. If cholesterol fluctuations can be managed effectively, it may be possible to reduce the incidence of dementia and protect cognitive function in aging populations. However, this will require a shift in both medical practices and public awareness. Until then, millions of individuals may remain at risk, unaware that their cholesterol levels could be silently undermining their brain health.